common injury in the foot is a plantar fasciitis. Plantar fasciitis is classified as pain kind of underneath the heel. And a lot of times plantar fasciitis it can be caused or blamed for someone who has flat feet. Oftentimes when I see someone come in to see me with who has a potential flat foot, they may have been to other practitioners who've given them an orthotic or an over-the-counter insert to go into their shoe. The theory behind that is that if you have a flat foot, the orthotic or insert can help to restore a more neutral arch. So if we have Ren here, we imagine he doesn't have really that flat of a foot, but if you can imagine the arch is a little flat here, what would happen is his foot would kind of roll to the inside, and that can create a little bit of pressure and stress onto the plantar fascia, the tissue under the bottom of the foot. So the idea behind the orthotic is to restore that foot back to a neutral position. And so what it is, it's an insert that goes into your shoe. Sometimes it's custom made to fit specifically to the individual's foot. Sometimes it can be more generic, something you get over the counter. But the idea is that that insert goes into the arch and it kind of lifts that foot up and puts the ankle in a more neutral position, and also kind of helps to provide some support to the plantar fascia so that there's not as much of a stretch on it or stress onto the plantar fascia. The problem I have with that is that, you know, in the foot, there are several muscles and joints that are meant to kind of move, and there should be enough strength in those muscles to naturally support that foot. So oftentimes, if there's a flat foot, the way I look at it is that is a lot of times a response to a bigger issue. So what I'll look for is to see, why is the foot flat like that? One of the more common things that we'll see is that someone who has really tight ankles and can't move the ankle back and forth will tend to compensate for that by creating more motion down at the arch, because movement has to happen somewhere. And our bodies are, you know, incredibly adaptable. So if something isn't working the right way, it's able to compensate and shift that movement or that stress to another area that may be able to do the job. So in this case, if there's a tight ankle, your body may decide that it'll start to move the arch instead. And so what we'll see a lot of times is the person may start to turn their foot outward. So if they just turn their whole foot out, point it out like this. So instead of walking straight over the big toe, they begin to walk more over the inside of the foot. And that way, they're not having to flex the ankle, but they're creating more pressure at the arch. And over time, that'll start to kind of weaken and flatten that foot out. Again, it's your body's way of accommodating that kind of mobility. So for me, what I try to do is, instead of putting the arch support in there, because the downside of putting an arch support in there is that if your body has figured out a way to compensate for a lack of ankle mobility, and then you put an arch support in there, which now limits the mobility of the foot, now your body has to figure out yet another way of compensating. And so we'll also see at times where someone will come in and say, yeah, I had this arch pain, I got an orthotic, that seemed to fix the arch pain, but now I've been experiencing this knee pain. So what ends up happening is the compensation just shifts up into the kinetic chain. So now the knee is moving excessively because the ankle's not moving very well. It had been moving more at the arch, but now the arch can't move because of the orthotic. So now we have to create more stress at the knee, and that will start to break down and cause pain at the knee. So a better solution is to start with the original problem, which is the ankle mobility. If we can improve that ankle mobility, then we can start to strengthen the foot back up to restore a more natural arch, and that's a better long-term fix. The other downside to the orthotic is I always try to remind people that, remember what happens to a muscle when we don't use it. It weakens. So if you allow yourself to walk in an orthotic all the time, and it's in every shoe that you wear, those muscles of your feet don't really have to do anything to support themselves, so they'll actually weaken further, which could leave you more susceptible to that pain, or you'll find that, you know, you're completely reliant on that orthotic in every single shoe you have. So again, we're talking the difference between causes versus symptoms. And oftentimes, if we treat a symptom, we can get maybe a more immediate relief, but it's rarely a long-term fix. We focus in on the problem, the underlying problem, which in this case wasn't so much the heel pain, it was the lack of ankle mobility and maybe the weakness or the lack of control at the foot. But if we can resolve those things, we'll have a much better long-term outcome.